um, the list of drugs and supplements and peptides that will help in destroying the cancer. And not just destroying the cancer only, but also to modulate the tumor microenvironment so it will be hostile for the cancer, which is polarization of the immune system to Th1, which is breaking down or breaking the fibrosis using clotho and olozartan, for example, normalizing the blood vessels by blocking the VGF, the vascular endothelial growth factors, that leading the blood vessels to be kinky and tortuous. And that's the cancer. What it does, it makes the blood vessel kinky, and they start growing. And when they are kinked, then what it does, it will prevent the infiltration of lymphocytes because the lymphocytes cannot pass through those kinked blood vessels. But it will still allow the nutrition to feed the cancer, but not lymphocytes. So you need to normalize that blood vessels by using blockers for the VGF, which is the vascular endothelial growth factors, like Avastin. So there's a cocktail of drugs that will um, destroy the cancer, whether using low dose chemotherapy, interfering with the cancer metabolism, or inducing enough of free radicals that will lead to apoptosis. So it's redox modulation, metabolic modulation, and then immune modulation, which is polarization of the immune system to Th1 and cytotoxic T cells. And doing that, then we have a complete cocktail of drugs and supplements and peptides that is being tested specifically for the DNA from the circulating tumor cells. And we have something that's personalized. We call personalized oncology, which I have the book written for that, and hopefully it's going to be published soon. Personalized oncology, along with using RGC testing and loading all those drugs, whether it is supplements or peptides or all of those drugs needs to be loaded inside cyclodextrin. And we are working on loading all those cocktail of drugs and supplements and peptides into cyclodextrin. And the reason why um, we need to stabilize those peptides and drugs and help to keep them longer in the body and target the pathology versus going everywhere. And that's the difference between naked drugs, naked supplements, naked peptide versus having a carrier delivery system that helps to take those drugs into the pathology, plus stabilizing it and stay longer in the body and linger more in the body. So all the drugs and supplements and peptides and chemotherapy is going to be loaded inside cyclodextrin, and you don't need much of the high dose when you load it in cyclodextrin. You can use less dose than the big pharma dosage. And also, you minimize the side effects, especially if you end up with, especially the injectable ones, you clock them or you load them inside, after you complex them with cyclodextrin, you load them inside platelets nanoparticle. And then the platelets nanoparticle will take those drugs because they will be in the size of up to 100 nanometer, and the size of 100 nanometer will not be leaking into the healthy tissue because the blood vessel is going to be tight to allow that, but they will be leaking to cancer tissue and pathological tissues. And doing that, you minimize the side effects because those chemotherapy and drugs are not moving to the healthy tissue, and you're targeting your drugs mainly into the pathology, so you can use less drug and you become you have less side effects. All those side effects that you can see from chemotherapy, we can minimize that, and you minimize the damage in your immune system because you don't want those chemotherapy drugs going to your immune system, or those immunotherapy drugs, anti-CTLA, and going everywhere because it will trigger autoimmune diseases. And when you trigger autoimmune diseases, what will happen? Well, those immunotherapy is being designed to make those cancer um, immune system to be polarized into Th1 and make those cancer to become sensitized to the immune system because it's being desensitized by the tumor microenvironments and the chemicals that the tumor is releasing. But you don't want to create sensitivity against your self-antigen. So those people doing immunotherapy without platelets nanoparticle, without targeting therapies, they have a problem where they may end up inducing colitis, inflammation in the colon, colitis, where the immune system is attacking your own antigens of your colon, or inducing rheumatoid arthritis because those anti-PDL-A and anti-CTL4 will definitely polarize the immune system all over, including your healthy tissues. But if you're loading those antibodies, anti-CTL4, anti-PDL1, into cyclodextrin, and then you put them in cyclodextrin nanoparticle, we can definitely uh, deliver those drugs into the pathology. So that's the target. There's a book. It's ready to go. Hopefully it's going to be published soon, so that um, we can have better tools
Dr. Halasa,
to manage
can,
chronic
Dr.
disease, including
Halasa,
cancer. Yes.
can you explain to some people new in the group here what the platelet nanoparticles is? How do you do this?
Yeah, so platelet nanoparticle, there's already a company out there. It's called Silo Therapeutic. It's a big pharma product. Everybody can go and visit their website, and they're very phenomenal. I mean, their products is very good. I mean, but it's gonna be like maybe 10 years, and they will be commercializing it because they're in the process of research and developments. And what they do from their side of perspective, they take any drug that's injectable, let's say chemotherapy, immunotherapy, and they first complex it with PLG1, which is polymers. Okay, and they use their own technology. I use cyclodextrin and I use sonication. I don't know what they are using, the other company, but they complex it. And there's many methods of complexing with PLG1 or cyclodextrin. They're all polysaccharides, by the way. And that gives them the size of 1 nanometer. But that's good for stabilizing those chemo or peptide or antibodies and possibly giving some targeting therapy there, but it's not enough because really you need the size of 100 nanometer, up to 100, to really prevent those drugs from going to healthy tissue because healthy tissue, their blood vessels are tight. They don't allow those sizes to go into or through their tight junctions. But the pathology, whether cancer or inflammation, their blood vessels are leaky. And so that's a good thing that we can create those package of size of 100 nanometer, and that will favor seeping into the pathology, whether it's cancer or inflammation, versus the healthy tissue. And that's kind of passive targeting. And so they load inside platelets nanoparticle. They take those complex drug with PLGA, they mix it with platelets and possibly sonications. That's what I do, sonication. And I do it through a very sterile environment where everything is going to be inside a sterile vials. And then we do nanofiltration to make sure, or an extrusion, we pass it through the filter. And during the pass of the filter, it helps to encapsulate those complex drugs with cyclodextrin or PLG1s. And then we make sure we do nanofiltration to ensure that we don't get anything above 0.22 microns or 220 nanometer. And and also doing the nanofiltration itself will lead to sterilization of whatever drugs that you're preparing because bacteria size, all the bacteria size is above zero point 0.5 microns. And so when you filter everything through a filter of 0.22 microns, which is 220 nanometer, then you're not allowing any bacteria to pass through that filter. And so this is called sterile filtration as well. And then you end up with a vial of chemotherapy or peptides or antibodies or even supplements, even curcumin, whatever, sterile in those vial, complex with cyclodextrin or PLG1s, and loaded inside platelets nanoparticles. So these membranes of the platelets, when you do sonications, they break up and they become free membrane like ghosts, and they start wrapping around those drugs in the process of the
But
sonication.
who is doing this? Is Dr. Jusuf doing this?
Dr. Joseph is doing it, Patel is doing it, and those two doctors are very active. All their procedures of treating, especially the cancer inflammation, even for your joint injections. It's not just for cancer. Let's say I have a joint and I want to inject the platelets. So I take the platelets, I can mix it with vitamin B12, I can mix it with thymosin beta, I can mix it with anything I want inside the vial, and I put it through a process of sonication and a filtration extrusion, and then I inject it to the joint. Or if I want to do cosmetic and I want to do platelets nanoparticle and filling up the face, I will do the same thing, and I can add
Yeah, but
many drugs and
not the
soften.
peptides, because the peptides they would break if you put them through a sonication.
No, no, no. The sonication is cold. The peptides will break if you put them in heat. But those sonications, we put ice in it, so we make sure the temperature does not go above five, above the temperature that leads to denaturation of peptides. And there is some sonicator, they have refrigerator inside them. And so it will just creating cavities for the cyclodextrin to load those drugs and for the platelets to break enough to create their release their exosomes and wrap those drugs without heat. So the ideal. Yes, if you end up putting it in sonication where you have heat, then you will denaturate the peptides and you destroy them. But if you sonicate them and you make sure the temperature is there, basically you're just vibrating it and packing them into cyclodextrin core, which is hydrophobic. But cyclodextrin can be at different cores. You can do hydrophilic or hydrophobic core. They have different size, and so you can use it for even load water soluble drugs, not just fat soluble drugs, like methylene blue loaded with cyclodextrin, indocyanide loaded with cyclodextrin, and then you can use this for photodynamic therapy to treat cancer infection. And you can use it for wound as well and put it in the gel, and you can have better delivery there. Even for your joint injections, using platelets nanoparticle loaded with all those drugs that you want to inject, including lidocaine, you can slowly release them or whatever anesthetics, it will be more effective because the cyclodextrin and platelet nanoparticle will turn those drugs into long acting drugs by slow releasing those drugs and changing their pharmacokinetics, and you have better results. Peptides, for example, most of those peptides, when you inject them in the body, they get degraded by the tissue enzymes. But if you load them with cyclodextrin, you protect them from being degraded easily. So you can get more peptides into the target pathology, and their function will go up to 10 times. That is that's what I'm doing, and I think we have compounding pharmacy already doing it, which we're going to talk about it when we finish up from the lecture today. Um, I don't know if she's still here or not, but somebody, yeah. Okay. So hang up because it's a CME. We're not going to talk about anything commercial now. We'd like to talk about more about the science behind those protocols. But yes, I have a book. I already created the book for each. I'm trying to create a book for each modules, which are the 15 modules that we talked about. And recently, Dr. Klatz told me I want to have an anti-aging book, and I end up saying he say I want 500 pages of anti-aging book. So I use artificial intelligence, by the way, a lot. And but you cannot use artificial intelligence if you don't have the theme and the concept of whatever you want to create. So you have to have the theme and the concept. So you have to have a human intelligence creating the concept of the book and the layout. So this is the concept of the book that I want to develop, right? So this is for anti-aging, and it starts for fundamental aging and all the biological and all the chemistry, and then the key anti-aging strategies, if you see it here, and the clinical application of and the protocols, exact dosage of the protocols for anti-aging. And then Then you need to know what is all the anti-aging drugs and supplements and peptides and exosomes out there. So you have the list of all of these are anti-aging drugs and supplements here. See that? This is all the anti-aging drugs and supplements that we have up to now that we know. All right. Okay. And then you say, I wanna you can say, okay, I want to classify it based on mechanism of action. And then I can classify based on mechanism of action, all these anti-aging drugs as you see it here, right? So mTOR modulation, autophagy activation. What is the drugs and supplements for that? Rapamycin, metformin, berberine, right? As you see it here. Senolytic drugs, what are all of them? Here's a go. Those are the senolytic drugs, ECGC, curcumin, all that stuff. And epigenetics modulation. What's the drugs? Here's the drugs. Hormonal peptides. What's the hormones and peptides? Here we go. Okay, and then regenerative medicine and stem cells also. It's part of anti-aging, but you cannot do anti-aging protocols before optimizing the health of the patient. So you cannot do anti-aging in somebody who's obese or somebody with diabetic or hypertension or has leaky gut. All of this or have toxins and fungus and mycotoxins and any underlying that needs to be managed by the protocol of chronic disease prevention management using those 15 modules, focusing on those four pillars, modulating the redox, metabolic, immune, regenerative across all medical specialties. And we talked about how all those medical specialties, all their chronic diseases can be classified into all those four categories. So we are treating diseases and we are approaching them not in a systemic way, but in term of pathophysiology way. And we're classifying those diseases based on their pathophysiology. Okay, so it's autoimmune diseases, it's part of immune balancing. It's is it redox? It is degenerative, it's under regenerative, it is metabolic. So those are the classifications. But most of the diseases and chronic disease, they have, you can see four of them. You can see there's some of it, it's yeah, mainly it's immune imbalance like rheumatoid arthritis. But in among the immune rheumatoid arthritis, you may the patient has underlying Lyme disease, right? So that's infection. Or the patient has leaky gut or has mycotoxins, right? So, or has vitamin D deficiency. So, all of this, when you're treating chronic diseases, you need to go through those four. Although the main thing is immune imbalance, but also you need to optimize all the other pillars of the chronic disease. You have to look for any deficiency in metabolic side and replenish that. You have to see if there's any problem with redox and the patient has too much of free radicals based on interior function test or ANS, it's imbalanced. So you need to give them enough of antioxidants or antioxidants that helps to change or express the genetics of the antioxidants, like curcumin and polyphenol. They work not just directly to neutralize the free radicals, but also expression and enhance the enzyme expression from the epigenetic level. We call them the genomics of the disease and modulating the epigenetics. Then after you do the chronic disease prevention management and you fix that, then he will say, okay, let's go ahead and put them in a course of anti-aging. Do we have a protocols for anti-aging? Yes. And I use the artificial intelligence, and you can come up with exact protocol, what exact drugs that you're going to use or supplements for the anti-aging, and what's the dosage. Like let's say here, this is the protocols and all the drugs and supplements and peptides that I have. Somebody's is ringing me. I don't know why. Colleen. Okay. All those drugs and supplements that we have, we are loading inside cyclodextrin. And you can say, okay, let's go ahead. We'll start with cyclodextrin-based rapamycin. How much I'm going to use? How much per day? Let's say 1 to 3 milligram weekly, oral or sublingual. Here's the protocols. We're going to use NAD and cyclodextrin loaded injectable and sublingual. And we're going to load them with cyclodextrin. What will be the dosage? 500 to 1,000 milligram per day, sublingual or oral, or injectable, uh, 1 to 2 times per week. Um, and so we have the complete protocol and dosage of all those anti-aging drugs and supplements and peptides, including the biologics, exosomes, and we can put together a program for anti-aging. That's what Dr. Clance wants me to do, and I already have this. So I take all this information that I have here, which is a mix of human intelligence and artificial intelligence, and put together a book where we have a reference for all those therapies that we have. So this is the protocols in details using all this maybe around 100 of ingredients, and you have a compounding pharmacy who will pack them together and putting in a form of a cocktail, and then you have a regimen for anti-aging that we use all those 100 ingredients in a wise way, in an efficient way, in an effective way, not just throwing it left and right, and in a structured way. And we can measure the efficacy of your anti-aging just by using the TO function test, because I like that. It's more functional. I mean, you can use those diagnostic biomarkers of anti-aging, and you want to do the telomeres length and many others chemically by using the lab. But I like it functioning. I like the result. If you improve the TO function test, that's mean you are modulating your oxidative stress, and you have less free radicals, less damaging the blood vessels. Means you're slowing the process of the aging. So let's say you do a nuclear function test and the score of the patient is 60, and you did all the chronic disease prevention management protocol first. You restore the metabolic, redox, immune, and regenerative status. And then you say, okay, now we optimize his health. Let's go ahead and do the anti-aging protocols, which are, as you say, all these things that we talked about. Um, and and when you did the chronic disease prevention protocol, you end up from 60 score of endothelial function test to 80 or 90 or 80, let's say 80. And you say, I want to go farther and turn it into 90 or 100. Then I will start giving them all this anti-aging protocols and regimen and all the supplements that we talked about, peptides, in a structured way, as you see it here, which is going to be all printed in a book. Um, and we come up with the score of an nuclear function test after 6 months of treatment, and it goes up to 90. And you end up maintaining those therapies and changing the lifestyle of the patient, diet, and the more they change in their lifestyle, exercising and sleeping well and eating healthy food, knowing exactly removing avoid all the food that's contaminated with xenoestrogens and all these contaminants, which I think the most experienced doctors here in my group is Dr. Tano and Dr. Stefan. Dr. Stefan, you can hire him and he will go to your house and bust your kitchen and bust your refrigerator, take all the food that's contaminated, put it in the trash and throw it away.
Yes, you're next, Dr. Halasa. I'm gonna come
Yeah.
grab a fridge.
So that's what Dr. Stefan does, and then he will tell you, okay, so now this is exactly the food you're gonna buy, and this is the sources, and he will give you the whole details, and you're gonna avoid all this. Oh, Dr. Cano also, he will go and have all the idea about especially shopping and the groceries, and he will tell you, oh, this one is this content is contaminated. It's a GMO. This one is not healthy. This cereal is bad. This is bad. You need to buy this. And Dr. Tano has experience, and he will tell you exactly how to end up doing grocery store shopping with grocery and buying the right food and nutrition. Which Stefan does it, but I can see Tano also he's very good in that. Um, and um, and then if you do that, if you end up following and adapting the exercise and the dieting, the lifestyle of Dr. Stefan, then you don't spend much. You don't need enough of spending your money into all those supplements that may cost you $1,000 per month. If you want to buy all of this and want to take them, you may end up reducing the amount of those supplements because you optimize your body, you're building up muscles, you detox your body from all those mycotoxins and free radicals, and you remove all those fat tissues, extra ones which are storing those toxins, that's the reason, I want to emphasize on this very important thing. Most of the patients, they don't like the GLP-1s. It's not because GLP-1s is causing the side effects directly by GLP-1s. It's just because when the GLP-1 is being used and you start shrinking the fat, the toxins that's released from the fat tissue itself is irritating the liver and it's causing the feeling of nausea and vomiting. So this patient who does not want the GLP-1 because of intolerance, it's not because of GLP-1 drug itself, but also it's because of the toxins that's released from the fat tissue. So he is rejecting the GLP-1 because the toxins that's being released from the fatty tissue is irritating his liver. And how you can make this patient to be tolerant is to provide a regimen of detox while you are doing weight loss and not try not to give them too much of GLP-1s and shrinking the fat rapidly, instantly, where you have a lot of toxins that can may cause organ failures. Try to do it gradual way along with detox. And the best detox you can do is cyclodextrin. And you can have a lot of supplements loaded cyclodextrin. You have the GLP-1 loaded cyclodextrin. You can do sauna. You can do glutathione. You can do NAC. You can all neutralize those free radicals. You can give them B complex. You make sure the methylation is being taken care of. You make sure that the mycotoxin is being detoxed. You look for any underlying chronic infections using chronic infection panels from the Cyrex lab and coming up with the whole bacteria and virus that's hidden inside the body and get rid from them using methylene blue and ozone. So you have to have a complete regimen and understanding your patient uh, condition and navigate the condition accordingly based on the data that you received from the patient and try to make your regimen to be tailored specifically to the information of the patient's history and physical exam and the lab results and develop your protocols to become more reasonable and efficient and effective based on also the income and affordability of the patients. And if you're able to create that, then you will be definitely able to manage and prevent chronic disease, and you can definitely solve the process of aging. But it requires a lot of skills there, and how you become efficient and effective in your approach with your patients. And that requires a lot of skills of how to break down your protocols and how you prioritize your protocols. And so you may learn from those lectures that we have here the logarithm and approaches and methodology, but you still need to use your basic extent and information of the patients and his financial status to tailor your treatments so it will not be a burden for your patients and may take longer for patients who doesn't have the right finance, but with time and with some with your skills and knowing exactly what's more affordable, what's more easy way approach, and especially Dr. Benoit is very good in that, and making his protocols affordable because he is treating patients of low income versus Dr. Joseph. He is treating patients of high income, so he can do all those protocols maybe in 2 months and 3 months and charge them and get them going. But for people with low income, it's not easy. Really, it takes time and effort and it will take longer and possibly with the skill that you have you can end up with the same results with people with high income. So all of this is factor in managing especially aging because it's very costly. I mean, think about all this 100 uh, ingredients and how you prioritize it and provide it to the patient and in a way it's going to be efficient and effective. So let's go back to the again, every module that we have, including anti-aging, this is book ready to go. Um, Dr. Class today, he told me, "Hey, I want a book for anti-aging, 500 pages." And I say, "Okay, here we go." And so you need to have the theme of the book that you write, the chapters and exactly what you're talking. So you have to have this human intelligence as a doctor to lay down your foundation and your chapters of your book and what you're going to treat. And then like let's say you put all the list of the drugs and supplements of the anti-aging, and then you give it to the AI and he will generate the book based on your concept and theory and theme. And so it will save 5 years and 10 years of editors and language and all that stuff and writing and typing into a couple of minutes. All right. And then you, after that, you need to edit it and go through everything and then edit it. The good thing about Amazon when you publish the book, you can revise the book and you can change it instantly. And that's the reason all the books that I'm gonna put on, then I will be asking you as a doctors to go through those books, and if you want to edit it, add it, want to co-author it, the doors are open, and we can share the pie, and we can all co-author the book. And the more we have co-authors and more review and seeing the book from different perspective and different angle, then we can come up with a book that is made by many brains, not by one brain of doctor, but many brains. And that's the power of the book when you have a lot of doctors contributing and authoring and editing the book. And so because then we will see the book from all different angle. But I can put the basic books there. But those books, whether it's going to be the Chronic Disease Prevention Management, which is a big textbook that me and Dr. Teno, we put it together. It's in Amazon. There's a little bit things I'm working on, but it's published there. But it can be updated and upgraded instantly. Anytime you say, "Oh, Dr. Halasa, can I add this chapter? Can we edit this chapter? Can we add this resume? Can we add this protocol?" No problem. I have the editors ready to go, and we can add, integrate any ideas, and we come up with all these versions, and we can upgrade the book that's already being published. Or okay, I developed this 300 pages of anti-aging book, and I put everything there. And then I say, okay, Dr. Teno, can you go through this book and add your perspective? Here's the copy of the book. And he added and all that stuff and change it. And then, okay, Stefan, you want to go ahead and edit the book and add your perspective? Okay, Teno will send the version to Stefan, and Sheldon will coordinate that. And then Stefan will say, okay, I'm going to add this and this and this and this. And then we take this book and we upload it. We can change the book that's there, which is chronic disease prevention management there, and we can just put it in, update it, right? And that's the good thing about Amazon. You can update it instantly, and here 2 days it will be out. And the same thing, same structure, everything. No, no, you don't need to have another book like second edition, third, which we can after 1 year. We can create a second edition, third edition, fourth edition. That's fine. But once we optimize the book from all different perspective, whether it's chronic disease prevention management, whether it's anti-aging, or whether it's immune modulation, because I'm coming up with a book where everybody now is going to use Cyrex Lab on and lymphocyte mapping, cytokine profile, and chronic infectious panel and toxicology. All of this needs to be we need to train them, and then I create a book there, and all the drugs and supplements are going to be loaded with cyclodextrin, and we have the pharmaceutical company who can do that. So that's a book for immune modulation, and we have a book for anti-aging, and we're going to have a book for regenerative medicine, um, and um, and so we're going to have books for each of those 15 modules. And this is the seven modules, the eight modules. We already finished the 1 to 7, I think. And the eighth module is all about anti-aging. We just talked about anti-aging. And in anti-aging, what is the principle of anti-aging? Or what's the basic? Let's understand the basic. In anti-aging, what we want to do. We want to get rid from the weeds and stimulate the stem cells. Is that what you do in gardening? When you're gardening your garden, or you are having flowers and in your garden, or you're having plants or trees, what you do? First of all, you need to get rid from the weeds, right? Because if you fertilize, if you give them water and fertilizers to those planets or plants that you are putting, or those roses that you are gardening, then what will happen? The weeds will benefit from it. And maybe the weeds will grow and overgrow and destroy whatever plant of interest that you are doing, or tree or whatever. And so in gardening, the basic thing we do is to remove those weeds first. So the fertilizers and the food and the drinks that I'm giving, it's going to feed only the trees and the plants that I want it to grow. Same thing in humans. What we do in anti-aging, we want to get rid from all the senescent cells, all the cancer cells, all the cells that has inflammasomes, right? So the inflammasomes containing cells, senescent cells and cancer cells, we want to get rid from them. How we can do that? Simply by fasting, right? You can do 12-hour fasting and or prolonged fasting. Ramadan, for example, it's coming. That's fasting. Um, And that fasting and stopping eating, when you stop eating, what will happen? Your body will activate the AMPK and inhibit the mTORs, and they will start eating their own bad cells. They start with own bad cells first. And what are the bad cells that will be, they will induce apoptosis for all those bad cells, which is the cancer cells, inflammasome, and senescent cells. So this is how you're getting rid from the weeds. And then after that, you eat. When you eat, you're inhibiting the AMPK and you start stimulating the mTOR and you start stimulating the growth. But what you stimulating growth of what? The healthy cells, the stem cells. But you got rid from inflammasome, cancer cells, senescent cells, and then you stimulate your stem cells. And we can do that with drugs and supplements as well. You can do rapamycin will inhibit the mTOR, and then you cycle it with some growth factors, right? That stimulate the mTOR. And when you are cycling this mTOR and inhibitors with mTOR stimulators, this is how you can get and reach to the optimal growth and stall the process of the aging, because you get rid from all this inflammasome and senescent cells because they secrete chemicals, those inflammasomes and senescent cells that will hinder the regeneration of the stem cells. And so it's very important to get rid from them first. And you can do that with a company that doing natural killer cells extracted from exosomes, from umbilical stem cells. There is among those umbilical stem cells, there's natural killer cells, which are stem cells, natural killer cells of stem cells of natural killer cells. And you can take their exosomes, and those exosomes and natural killer cells will, when injected into the body, will get rid from your inflammasomes and cancer cells and senescent cells. So it's a part of anti-aging. So those natural killer cells from those stem cells of the umbilical cells or umbilical cord, those natural killer cells, exosomes that's been extracted, they have a way to separate it. They can and inject it into the body. They can attack all those inflammasome cancer cells and senescent cells and get rid from them, and it does help. And then you can give them the exosomes, the regular exosomes after that, which will stimulate the endogenous stem cells and help in growth and start the process of the aging. So that's one way of of doing things. And you can alternate natural killer cells with the regular exosomes, and you get rid from the weeds, which is cancer cells, inflammasome senescent cells, and then you stimulate the growth of the endogenous and rejuvenate the tissue of your body. Or you can do it with drugs, you can do it with peptides, you can do it with supplements, and we have the list of all of that, and we have the protocols of all of that. But that's the basic of anti-aging. All right. So now we understand why we are doing anti-aging, and how the anti-aging works is to get rid from the weeds and stimulate your endogenous stem cells. And again, you cannot do anti-aging before you optimize the health, before you do chronic disease prevention and management. You cannot do anti-aging with somebody who's obese, somebody's toxic with fungus or mycotoxin, somebody with underlying Lyme disease, somebody with hypertension and diabetes, somebody with atherosclerosis, somebody with rheumatoid arthritis. All of this needs to be balanced and optimized using those four pillars. You modulate the immune system, you optimize that. You're looking for any metabolic deficiency, optimize that. You get rid from any free radical generators, whether it's coming from the leaky gut, from the bacterial infection, from the viral, um, from wherever it is. You need to neutralize that. And after you do this, then you say, okay, let's go ahead with doing anti-aging and regenerative medicine, right? And doing it by getting rid from the weeds and stimulating the endogenous stem cells. So that's the concept. You can use NAD and AD. Yes, it will activate the mitochondria, and also it helps when you activate the mitochondria. By the way, anything that activates the mitochondria will induce apoptosis of the senescent cells, cancer cells, and inflammasomes. So NAD is part of helps to activate the mitochondria, and when you activate the mitochondria, it get rid from the inflammasome cancer cells because you are inducing mitophagy, right? So how I can get rid from those inflammasome senescent cells and cancer cells, in addition to inhibiting mTOR, is to activation of the mitochondria. And once you activate the mitochondria in those inflamed cells or cancer cells or senescent cells, you will induce apoptosis and you get rid from it. So it's part of or you trigger this, you give them senolytic drugs which will trigger the apoptosis as well, and you get rid
But
from the weeds, inflammasomes, senescent cells, cancer cells. And then after that you go ahead and you start giving them all those growth factor peptides or stem cells or anything that regenerate your stem cells. So that's module number 7. um okay, let's go ahead and finish up those modules. And then we have another modules, which is nanomedicine. And we just talked about nanomedicine. And we can do nanomedicine, clinical nanomedicine in your clinic. You can turn all those injectable drugs into clinical nanomedicine. You can take your uh, peptides, you can take your injectable supplements, your chemotherapy, immunotherapy, and you can load them inside platelet nanoparticle by using sonication, and we can train you how to do that. And so you can have better outcome because you will be able to do what we call the targeted therapy. And getting those medications and supplements and peptides into the targeted pathology. Now, you can have the compounding pharmacy and ask them, okay, can you load them inside cyclodextrin first and complex it? And they can do it, and then they give you this, okay, this is the peptide that's loaded with cyclodextrin. This is our anti-aging drugs that's loaded by cyclodextrin. This is the chemotherapy that's loaded with cyclodextrin. Then you take it and you take the platelets from the patient, you mix it together, and you put them in a sonication, nano extrusion, and nanofiltration, and you end up with a drug that's being packed inside cyclodextrin, inside place nanoparticle. And now you have what we call targeted therapy. And you can do it clinically. You don't need to wait for this company called Cero Therapeutic for 10 years for them to release and mass produce platelets derived or platelet loaded drugs. You can look at it. That's the future. But why are we going to wait for 10 years and waiting for this company? You can start it from now and make this technology familiar, and and everybody can do it because I already have, as I said, there's two active doctors among my group that they do this every day, Dr. Yusuf James and Dr. Patel Kalpana, and they are getting tremendous results, and you can able to manage any disease out there, and you have more confidence because all the drugs that you're using, you will having minimum side effects. comparing to the mainstream medicine.
Okay, I'm gonna come down to Sunny Isles and learn this from you guys.
Right. So this is something that you can learn, and I did train around 10 doctors or 11 doctors, but the two doctors that they're active are just two doctors, and now they can treat cancer. Like, and then we have a book for we already I already wrote a book on cancer treatments, all the protocols, and using nanotechnology, using RCGC, which is personalized oncology. It's a book. It's already written, personalized oncology, and we use nanomedicine to low dose chemotherapy, and you don't use to use that high dose anymore. You can use 10% of the big pharma dose. You can start with that, and you have almost zero side effects. And you can use photosensitizers. You can activate those chemotherapy with light. It's called low dose chemotherapy. Activate low dose chemotherapy. And you can use photosensitizers. You can use peptides. You can use supplements, and you can test those cocktail of drugs and supplements based on the genetics of the cancer, which is you take the blood from the patient of cancer. They have circulating tumor cells. You send it to RGC lab, and they will do DNA analysis and come up with say, okay, this is the chemotherapy that the patient is sensitive to. This is the supplement that the patient is sensitive to. This is the peptide that the patient is sensitive to. So they give you a whole list of drugs and so it's a personalized. And then you take those drugs and all that. You ask pharmacy, like and you ask them to load them inside cyclodextrin. They will load it, injectable. We have a pharmacy, the Strive Pharmacy does the injectable, and then you take those injectables and from those pharmacy, they provide a very nice cocktail and ready to go. And then you take the patient's blood, you use it. You take the platelets. You can easily take the platelets, right? You can use those tube that has a gel and separate the platelets. Or I can teach you the technique where you can use syringe and use it. But I like, you're charging those treating those patients. You're charging them like big bucks. Use just the gel and get the concentrated platelets. It's easy, just one spin and you have the platelets. And then you mix the platelets with the drug in a sterile vial, and then you sonicate it, and then you nanofilter it, extrusion, and you have your drug ready to go. And then you inject it to the body, and then you can go ahead and activate it. But with fiber optic lasers, you can go and put it into the center of the cancer. You can inject those cancer with those chemotherapy and immunotherapy, by the way, and all the drugs and supplements that helps to turn the tumor microenvironments from being friendly to the cancer to hostile to the cancer. And there's a book on that showing exactly what you need to do. That's part of the book about all this tumor environment thing. But also you can do it not just for cancer, you can do it for degenerative disease. You have a patient with a knee joint osteoarthritis. Okay, take the platelets loaded with peptides, supplements, lidocaine. Even you can load, if you want to do steroids, low dose, that's fine. Hydrocortisone, low dose, you load with platelets, that's okay. Low dose does not cause that much of degeneration of hydrocortisone. But of course, you use high dose and naked drugs, yeah. Um, and you can load all of this in your platelet nanoparticles, and it will be slowly released, and you get better results. And all those growth factors are slowly released, stay longer, and you can mix it with your, as I said, with cyclodextrin. You can mix it with your gel that you're doing for the joint, and you can get way better results versus just dumping stem cells and platelets into the joints. Um, and you can do the same technology. If you don't want to do platelets nanoparticle, you can do exosomes from any place, and you can sonicate it and clock them with and enhance them with supplements and drugs or whatever you want. If you don't want to do platelets nanoparticle, you can take exosomes and you can do it. Or you can use stem cells and you can break it down with sonications, and their membranes will clock those drugs, encapsulate them, and get them into that size of up to 100, which will passively target the pathology. And because the platelets and the stem cells do have receptors, natural receptors, that target the inflammasome, senescent cells, cancer cells, and infection, bacteria and virus, then you are actively targeting those. So passively by the size of 100, which leaks into the pathology. Actively is by the receptors on those platelets membrane that specifically has tendency to attach into the inflamed area, injured area, uh, senescent cells, cancer cells, even bacteria and virus. Let's say if you have a bacteria that is resistant to tetracycline. Do you know if you load them inside cyclodextrin, you clock them with platelets nanoparticle, and you inject them, you can break that resistance? Yeah, that's a good thing about those nanoparticles because the way that the resistance happen is that the bacteria will develop certain way, will inhibit all those trans membrane protein that shuttle the antibiotics into their inside their the bacteria. They mutate it, they change it so that the antibiotics cannot get in. But once you clock them inside those cyclodextrin or place nanoparticle, they will go through another way, maybe into cytosis. Also, cyclodextrin itself, it is anti-infective, and it helps to disrupt the membrane of those enveloped viruses and bacteria. They certain way pick up those cholesterol and make holes and so it does have antibiotic, those cyclodextrin itself, an anti-inflammatory. In addition to that, the cyclodextrin has the ability to absorb mycotoxins. So there is nothing out there that will detox the mycotoxins except cyclodextrin. There is nothing out there that effectively will absorb and detox the body from fat soluble toxins and cholesterol that's being deposited into
Mhm.
atherosclerotic blood vessels. Only cyclodextrin can do that. And then dicyclodextrin will go and clean those blood vessels or clean your body from those mycotoxin or fat soluble toxins and then dump them into the liver. It is very important that you rejuvenate the liver and you give them all the green stuff that helps to rejuvenate the liver. Um, I mean, there's Audrey, if she's still here. She's very good in putting nice smoothie for healthy liver, along with Dr. Joseph James. They used to do it together. That's a good thing because when you do detoxing, you need to you need to have an active functional liver. Because the liver does so, even if you give cyclodextrin to the patient and his liver is sick, okay, the cyclodextrin picked up all the junk, but how are you gonna get rid from those cyclodextrin loaded with junk of mycotoxin, fat soluble toxins, or whatever he's carrying? The cyclodextrin dumps it into the liver bile, and so you have to have healthy liver to carry those bile that's containing all this junks of cyclodextrin complex with all this dirt, and so you have to have so milk thistle and all this green juicy that you have. It's a good thing, and I think Dr. Joseph has very mastered that cocktail. And when you go to his house, he will provide you his morning smoothie. And I've been with him for 1 week, and I enjoy the smoothie that he does every morning. Um, and so now, when you have this ability to do nanomedicine at your clinic, you will really have the ability to master anything. You have the tools. You have all the immune modulation tool. You know how to modulate the immune system. You can target them with your nanoparticle. You know how to modulate restore the metabolism. You know how to restore the redox status. You can monitor the redox status using an NTO function test. And so you are in your brain when you are approaching and managing and taking history and physical exam, you have those four pillars all the time in your brain. Even in collecting history, okay, what disturbed the oxidative stress, or what disturbed the redox status of the patient? Whatever history that disturbed the metabolism. Let's find all the leakage of the free radicals, smoking, stress at work, at job, all those stressors. You can start looking when you take your history and your physical exam in your mind with those four pillars. You can have better perspective in collecting comprehensive history physical exam, which American Medical Association, they came up with something that's called the 300 HP history physical exam, which we adapted as chronic disease prevention and management. Um, and then the pillar number 11 is redox therapy. When I say redox therapy, it's not just antioxidants, and it's also the light therapy, the photobiomodulation, all this energy form of therapies. Tesla, electromagnetics, light therapy, ozone, oxygen therapy, name it, shockwave, they all work through redox. So this quantum energy thing and quantum medicine, all this thing, universe, no, that's how those energy works, how the light and a shockwave and EMF interact with your biology is through redox. And so understanding that if I want to stimulate your body, I need to produce enough of free radical physiological level to stimulate the expression of the genes, of the growth factors and anti-inflammatory cytokines. And if I don't induce these physiological free radicals, then I don't have enough of growth factors and anti-inflammatory cytokines, and then the patient will end up with atrophy. Example, if you don't exercise and you don't stress your body with exercise, you will end up with atrophy. Your muscle will slow, you'll shrink. Because to activate the gene expression and growth of those muscles, you have to induce a stress, a physiological spark of free radicals to enhance the expression of the genes. And so you do exercise. And too much of exercise beyond the norm, it can flip from the physiological free radicals to pathological free radicals, which will cause actually suppression of the gene expression of those growth factor anti-inflammatory, and it become more causing atrophy and shrinking again. So it's very important during exercising, and there's a lot of technology out there, which is some watches. They will tell you about your heart variability, and when your heart variability is getting abnormal due to excessive exercising, that's mean you're switching from physiological free radicals to pathological free radicals, which is interfering with your autonomic nervous system balance and is causing damage to autonomic, and that's where you need to stop exercising and have a rest, because if you do, you're not building muscle, you're destroying muscles. And then so all your body gene needs some sort of spark of free radicals in order for them to work and function and express. And you can induce that and provide that, not just exercise. You can do it with light. Light will activate and generate spark of free radicals because they open up calcium channels, and this opening up calcium channels will activate the NOx enzyme, generate the physiological free radicals that will enhance the expression of this anti-inflammatory cytokines and growth factors. Or you do shock waves. During the shock waves that you do, you generate some spark of free radicals that will enhance the expression of those genes as well. Or you do AMF. EMF will open up calcium channels and will lead to a spark of free radicals. But if you do AMF long term, constant exposure, like the 5G, then those calcium will stay open, and too much of calcium will activate too much of NOx. Then you're not generating physiological spark of free radical. You're generating pathological, constant, high free radicals, which will cause damage to the DNA and expression, and we will actually stop the expression of those genes. You end up with atrophy. You end up with, instead of expressing anti-inflammatory cytokines, you'll be expressing inflammatory cytokines. You get inflamed. You aggravate the whole underlying chronic diseases, and that's what happened to the patient with EMF sensitivity. And so, when we are it's very important when we manage the patients, we need to restore the redox balance. And we need to give them that spark of free radicals, whether through diet that is rich of antioxidants and polyphenols, or exercise, or light therapy, or shock wave, or whatever gives you that spark of physiological free radicals that balance the redox status of your patient. The 12 module is regenerative therapy. So you don't do any of those therapies. You don't do regenerative therapy before you fix the redox and metabolic and immune. You fix that, and then you go ahead and say, now I want to do anti-aging and regenerative. Now I want to introduce exosome. But I got rid from you need to get rid from the senescent cells and inflammasomes and cancer cells using the three modes, the metabolic, immune, and regenerative, using those senolytics and inhibitors of mTORs, whether through fasting or through supplements and drugs that works on those, and getting rid from the inflammasome senescent cells. And then we'll say, okay, let's go ahead and do the anti-aging drugs and stimulate the mTOR and stimulate the regeneration of your endogenous stem cells. Whether you want to use photobiomodulation, you want to use all those growth factors that we have, then yes, then I think then you use exosomes. Again, you can use a natural killer derived exosomes to kill the
Right.
inflammasome senescent cells, cancer cells, and then you can use the regular exosomes to regenerate. So there is two kind of exosome. There's exosome coming from umbilical cells, that's natural killer cells, and that's good for getting rid from inflammasome senescent cells, cancer. You give them that course, and then you maybe alternate with the regular regenerative exosomes. Or you want to inject the joints with platelets nanoparticle, yeah, with plate PRP, activated with light, with photobiomodulation. That's good to do nanoparticles and use platelets nanoparticle loaded inside a cocktail of peptides and supplements, and then inject them into the joint. You get better results, and then you can activate that platelets nanoparticle or stem cells or exosome using photobiomodulation. So when you do your injection, you can put light into your joints at the same time. You can do some ozone. That helps to rejuvenate those tissues, and using combining therapy in a state of one month. Now, the number 13 module is central pain and peripheral pain management. One of the problem that we have in pain management is those doctors, they are treating peripheral pain by doing all those injections, and the patients say, oh, I still have pain, although the peripheral pain is being taken care of. Whether we block the nerve or give them enough of stem cells in their joints, and really there's no inflammation in the joints, but the patient still have pain. And if you start feeling the joint, there's no tenderness from where the pain came from. Well, it's not necessary the pain is coming from the joint. It could be coming from his brain because of the long lasting of pain that the patient is endure for a long time. What happened to those neurons that are being activated and being bothered for that long lasting pain that the patient is suffering? The neurons that receiving those signals of pain, they can undergo something is called neuroplasticity. They grow, they branch out, they grow, and you will have what we call progressive neuroplasticity of all the pain pathway from that joint. And so even if you fix that joint and there's no pain signals coming from it, you take care of the inflammation. But because of the growth and the neuroplasticity that happen into those pain circuits of the pathway that's coming from this joint, then even without any external stimulus, they can fire spontaneously and make you feel that's the pain. That's called central pain. And how you get rid from that? Well, you need to restore the neuroplasticity of those pains and pathways and circuits that's coming from this joint centrally. So you need to restore you need to break down all this neuroplasticity, those dendrites that's being overgrowth. You need to get rid from them and break them and loosen them up and decrease the number of the synapses. And that's restoring those neuroplasticity back to normal. And you do that by many ways. You can use that using intranasal progesterone as regenerative steroid, right, in the brain. It helps to decrease the inflammation. Once you decrease the inflammation and you reduce the oxidative stress, which progesterone does that, and stimulate the GABA, then you are able to reduce or restore the neuroplasticity. Once the inflammation is down, oxidative is down, then those neuroplastic change and those extra synapses will break up. And those dendrites, that's excessive ones, that will regress because what's keeping them active and connected is the free radicals and oxidative stress and gliosis. But once you take care of them with intranasal progesterone and you put the inflammation down, your neuroplasticity and all those, it will regress back to normal and normalize. And when you normalize, you are neutralizing those spontaneously firing that's happening in this due to from those neuroplastic changes in the brain. And again, not just the intranasal progesterone. You have to hit it from all different directions. You can use CBD. You can use detoxing the body, cyclodextrin, especially low progesterone. You can use peptides, thymosin beta. You can use AR, which is erythropoietin derived peptides. You can use many things. You can use the heptadine, which is coming from angiotensin 1 to 7. All of this helps in restoring the neuroplasticity through restoring the oxidative stress and the brain inflammation back to normal. And once you do that, um, even you use light therapy as well, you use cognitive therapy, many techniques to help to restore. You use EMF, some EMF that you put in the brain helps to um, um, activate antioxidants and reduce the inflammation, oxidative stress, and restore the neuroplasticity of the brain. Okay. And the same concept for drug addiction, when the drug addiction, because their circuits of their brain that is rewarding the drug is hyperactive, and neuroplastic changes in its and their circuit is growing big, and is taking over any other circuits, any other activities, and nothing will cause pleasure to the patient except taking those drugs. So, and that leads to demolish all the activities and circuits that leads to other activities like having fun with their wives, or socializing, or playing soccer, or playing tennis. All of this neuroplasticity, or those circuits, will be abolished because of the inflammation. And while the neuroplasticity circuits of that rewarding the drugs is going to be big and hypertrophic, and so the patients can only can get pleasure on dopamine is going to be high only for that drug. So you really need to break that neuroplasticity of the drug, of those circuit drugs. And how you break it down, by using intranasal progesterone, CBD, cognitive therapy, all those things that helps, psychedelic ketamine, that helps to reduce the inflammation, oxidative stress, at the same time increasing the dopamine and serotonin, but not from the drug, from whatever intervention that you're doing. So it's a psychedelic or using CBD, yes, it will create some euphoria there for that drug, but without causing a neuroplasticity and dependency, and this will break the neuroplasticity circuits of the drug, addicted drug, and you will end up freeing yourself from that addiction, normalizing your neuroplastic changes, or neuroplasticity of the brain back to normal. So that's itself. We're going to create a book on central pain. I have a very nice lecture in YouTube about central pain and drug addictions, and how to restore the brain neuroplasticity of that specifically for that drug, or neuroplasticity of the pain, how to restore that back to normal, and lower and higher the threshold of the pain. We can create a book here. I don't have the book yet, but I think we're gonna create a book for this. So we have a book related or cover the module number 13. Um, the other part is peptides. And the problem with peptides and all the lectures about peptides is that the doctors are giving peptides, and they may know some of their mechanism of action, but there's a lot of shooting in the dark here, especially when it comes into immune modulation. You cannot give thymosin beta for patient with cancer. Why? Because it will modulate the immune system into Treg, and causing even the cancer to grow more. So it's very important to know the mechanism function of those peptides. Some peptides modulate the redox, some peptides modulate the metabolism. In general, some peptides modulate your immune system, and you need to know where it's modulating it. Is it more to Th1 or Th2? Because if you're giving the wrong peptides, you may end up aggravating that condition. You may aggravating that cancer. You cannot give erythropoietin derived peptides for patients with cancer, because that tend to polarize the immune system to Treg, and we want to in cancer to polarize the immune system to Th1. So it's very important to know about those peptides and how it works. GLP-1, they are peptides and they help in reducing the appetites and help to reduce the weight and helps to increase the sensitivity of insulin. So yes, knowing those mechanism of action of peptides and how it works and their clinical applications, their protocols, it's very important because if you start giving those peptides in the wrong way, you may induce cancer. If you start giving growth factor peptides without giving them, without alternating with mTOR inhibitors, and you're giving those growth peptides without alternating with peptides that inhibit the mTOR, you end up may induce or stimulate the cancer. So the patient has already some cancer cells in the body, and normally we need to use the regimen of alternation of mTOR inhibitor, mTOR stimulator. But if you don't do mTOR inhibitor and start giving them growth factors, those factors will feed those cancer cells, and you may lead to those cancer to break out and grow, and you may be part of causing cancer because of the ignorance. And so it's very important to know those peptides, how it works, what needs to be, how much dose we're giving it, and what we're doing it, and why we're doing it, based on the data and the lab and the need of those peptides. You get it from the patient's lab, and understanding those peptides, if there are growth factors, you make sure that you alternate it with peptides or supplements or drugs that inhibit the mTOR and making sure that all the inflammasome senescent cells and cancer cells being taken care of, and then you give them the growth factor peptides. Or if you have cancer, you don't give them thymosin beta. But if you have wound and you want to stimulate the wound healing, yeah, you can take thymosin beta and you put it in a gel or cyclodextrin and a gel, and you start putting it in, when you can add platelet nanoparticle, and you can mix them all and sonicate them, and then you can create a nice gel that you can put in the wound, which will stimulate the healing because you want to move in healing the wounds, you want to move things into Th2 and MREG. Um, the last thing is the module number 15. I think this is the last thing is regulatory and compliance, which we can have a book on it as well. What's important here, and this is just simple and easy. You don't do anything with the patient without consent, letter of consent. That all the treatment that you're providing, all the investigation that you're seeking, it could be possibly investigational. I mean, some of them are big pharma protocols approved where they have insurance, and whatever you're giving, if it's something to happen, the company who make this drug can cover it through their insurance thing. But if you do something off the label, there is no way for if something happened and any errors happen, then the patient can sue you, and really there's no coverage there, and that's why the whole system is based on suing and based on. So it's very important to have a consent letter that okay, we are using those treatments. Some of those treatments are investigational, and if the patients agree, and also you tell them any treatment that you're providing, you need to show them the cons and the pros, not like we're doing in vaccine, where we mandate the vaccine without letter of consent. That will bite back to you, and your doctor, you will be obligated to answer that. So it's very important that we have the consent letter of consent. It includes all the treatment and diagnosis that you're going to do, and also when you talk to the patient about any treatment, you have to tell them the cons and the pros, and he has to agree on it, and so that you clear yourself from any liability. So that's the important part, and when we're writing those books, we will include regulatory compliance and ethics. So when we write anti-aging, a regenerative book, we will have a chapter specifically for ethics and regulatory, so that we will have a comprehensive training that include everything all the tools that you need to manage chronic diseases from A to Z of all different medical specialties. And I think we are done from the lecture today. Is there any questions? Is Audrey's here? Audrey? Sorry, I was supposed Audrey's not here. Okay.
We did have a question in the chat.
Right. What's the question?
Okay, and let me scroll up. Hold on. Dr. Quinn
Dr. Quinn
asked
asked
if
if
there
there
was
was
a
a
protocol to get rid of
plant
plastics in the body, and
and
there
there
was
was
a
a
way
way
to get them out of the body.
What is that? Can you repeat that question?
Is there a way to get plastics out of the body?
Yes, cyclodextrin is a complex with microplastics, and you get rid from it by cyclodextrin. Whether it's loaded with curcumin, there is an Amazon cyclodextrin loaded with curcumin, but I don't know whether it's decent or not. But we have compounding pharmacy are loading it with progesterone and oxytocin, and I rely on that. So the cyclodextrin will take care of the microplastic fat-soluble toxins, organophosphorus, mycotoxins, and also any oxidative lipids in the atherosclerotic plaques.
And then a question I asked, is there a sequence of the modules that
that
you
you
recommend
recommend
when learning?
Oh, the sequence of the modules. Really, it's based on the patient's data and what you need to prioritize. You cannot do copycat and apply all those 15 protocols at the same time at once for the patients. But when you take the history and physical exam, you need to include those in your brain, and it helps you to guide you and getting the information out and the exam that you need to do and lab you want to do, and then it will guide you exactly what treatment you need to start with. Let's say if you have rheumatoid arthritis, the first thing you want to do is to balance the immune system. And if you have rheumatoid arthritis and it's Th1 and Th2, Th17 dominancy, you're going to find all the supplements and drugs and peptide that have the Th1 and Th17 and move it to Treg and Th2. So it's immune modulation that you start with. Okay, is that enough? No. Maybe the patient has a deficiency of vitamin D. That itself is causing more imbalance in the immune system. We need to work on that. Give them vitamin D. Maybe a problem patient had methylation, have oxidative stress, which aggravate the inflammation and the hyperinflammation of Th1, Th17. That needs to be taken care of. Maybe patient has underlying chronic infection. Maybe patient has leaky gut. Maybe patient has diabetic atherosclerosis. You need to really screen all this. Maybe patient is taking drugs or whatever, it's aggravating the conditions. And then based on that, you need to go through the same sequence. Metabolically, I fixed him. I replenish all the nutrition deficiency, supplement minerals, redox. I give them enough of antioxidants. Endothelial function is improving. I checked any free radical generators and I neutralize that. I check if he has methylation problem. I fix that. Okay, so that's good. Let's go ahead to regenerative. Now, after we fix all of this, let's go ahead and give them some exosomes or stem cells, or do some dieting or alternating them mTOR inhibitor with mTOR stimulators by fasting and give them the right diet and exercising and all that stuff. So, you are your treatment and protocols has to be based on the patient's input. That will guide you, but you have the logarithm. Once you have the logarithm, then it can be applied with any equations that you are receiving from the patients, which are vary from one patient to another. Does it make sense? Yeah, so we're not robots. We are doctors and we need to be flexible, and our brain is neuroplastic, and it's like a mold, and it can change and adapt, and we can apply those principles and logarithm to any chronic condition that you have here. What's important is the logarithm. Once you got the logarithm, you can answer any equations in front of you. Any other questions? Dr. Naryu, are you there? Any question, Dr. Naryu? Stefan, everybody's happy? Dr. Quinn, am I still on? Sheldon?
Yeah, you're
Yeah,
on.
I asked a question in the chat, Dr.
You're good.
Halasa. Real quick question.
When are you coming back down to Sunny Isles? I'm going to come visit you guys, learn this platelet nanoparticle.
Yeah, we need everybody to start working on it. We're gonna have books. Um, the
But
logarithm is
you,
gonna
when
be
are you going to
shared.
come?
Oh, me?
Yeah.
I mean, it's all about the demands there. If you end up saying yes, I'm interested, I have to bring you all the equipments, and it's not just that. It requires some sort of preparation.
Yeah.
But we can do it. Let's do it when we go to April,
Okay.
to A4M.
All right. Sounds
We're
like a
gonna
plan.
spend there 1 week together. I can extend and have another week, and we can do all the training for you, and possibly there would be more participant there where they
Sure.
have the hands, and at that time we have all the books being published, so you have all the references, and then you start working on those published books and edit it and add it from your perspective, so we can optimize those references and make it to be book for everybody that adapt all the inputs and vision and perspective from everybody here.
All right. See you guys tomorrow. Clearfield's got a good show tomorrow, I
Yeah,
heard.
tomorrow. Okay, everybody's good.
Mhm.
I think I have Audrey. She left, and then somebody. Okay. So Tatiana, yeah, she's not here.
Yeah, Dr. Halasa.
Oh, yes.
Yeah, my quick question was, do we have any effective type of protocol yet to remove micro or nano plastics?
Yeah.
I
So
think I know.
psychodextrin, which you can use loaded with progesterone, oxytocin, the one that National Pharmacy has. Let me take this off.
How's that going to remove the plastics?
They will form a complex. Let me remove the recording
And
here.
then what is that going to be dumped into the intestines through the bile, or is it going to go
Most of it is
liver?
going to go to the bile. Some of this go to the kidney.